There are concerns Tweed Hospital is buckling under the pressure with no COVID diagnosis equipment available. It comes as local COVID cases are almost tripling daily, faster than the 50% rise in new cases reported in New South Wales. Joining me live is Acting General Secretary for New South Wales Nurses and Midwives Association, Shaye Candish. Good afternoon to you, Shaye.
Hi, how are you?
I'm well, Shaye. More importantly, what have workers said to you about the pressures and the conditions that they're under at the moment?
Look, our members, the nurses and midwives of New South Wales, are under extreme pressure. The stories that you're referring to at Tweed Hospital, we're seeing across the state. Frankly, there's more hospitals with problems than there are without at the moment.
So do the restrictions at the moment go far enough? The conditions that the New South Wales government is bringing into place now, we're seeing changes, to dance floors, and we're changing to rapid antigen tests, and this has all sort of been announced this afternoon. Is that going to be enough to curb what we're seeing at the moment?
I don't know if it's going to be enough. We would welcome anything that helps to reduce the transmission at the moment, because our nurses and midwives, they really need all the help that they can get. They're working double shifts, they're working huge amounts of overtime, they're doing most of their work in complete plastic head to toe. Some of them are working out in makeshift triage tents in the middle of the summer heat. It's a really challenging time. So if there are any measures that the government can take that can reduce some of the pressure that our members are experiencing, we would be supportive of that.
One of those measures, there has been a pause on elective surgery. Modelling is showing that, according to the New South Wales government, that even in a worst case scenario, the health system has capacity, but it's also the people power, isn't it? Because you can't underestimate these long shifts for exhausted staff in all this protective equipment, as you said, in these really hot conditions.
Look, I think there's a real disconnect with what the Premier is currently saying and what our nurses and midwives are experiencing. We don't think that the system's coping. So taking measures like reducing the amount of elective and non-urgent surgery is absolutely necessary to keep the service running that's there now for all of those patients that are coming in with COVID positive symptoms, but also for the people that are presenting to emergency departments with things like chest pain and broken bones and abdominal pain. All of those things have not stopped. In fact, in some cases, they've only gotten worse. So we need whatever relief we can possibly have to reduce that pressure.
What would you like to see? What do you think you need, aside from these elective surgeries being postponed at this point in time? In an ideal world, what would you like?
Look, the reality is that there are not people, nurses and midwives that are going to fall from the sky. We would welcome the support of the private sector to offer a surge workforce. But what we would call for really now is that the government recognises our members, the nurses and midwives of New South Wales, and gives them compensation, because frankly, there's no measures they can take now that are actually going to make life more bearable for our members in any real meaningful way. They're turning up shift after shift under incredibly tiring and challenging circumstances. So paying them some type of compensation that recognises the work that they're doing is the least that they can do.
New South Wales Health Secretary Susan Pearce said in this afternoon's press conference, if she needs to get back in her working attire as a nurse and help out, she will. It is at that stage that hospitals are calling for people to come back from holidays, calling for retired staff to come back and just help where possible. Is that what you're seeing?
Absolutely. The reality, though, is that most people that don't have to come back into the sector don't want to. The conditions are so incredibly challenging that unless someone really needs the money, why would they come back? Why would they work for 10 or 12 hours a day in head-to-toe plastic unless they had to? The conditions, frankly, have become so challenging that it requires incentivising.
Just before I let you go, Shaye, I suppose a message to those at home watching this: if you need to head to a hospital, if you are feeling unwell, we just had a doctor on before, I guess it's be patient and be kind as well.
Absolutely, and use those emergency services for emergencies. So manage what you can in the community, see your GP and use those emergency services when you need them.
All right, Shaye, we have to leave it there. Shaye Candish from the New South Wales Nurses and Midwives Association, thank you for your time. We wish you and the team all the best.
Thanks for your time.